All right, ladies and gentlemen, so we are on Legal and Ethical Responsibilities PowerPoint Part 2, and we're going to start with legal disabilities. Now, when we talked earlier about making a contract with someone, I said that it had to be someone of sound mind, and this is where we're talking about of sound mind. So minors, someone that's under the age of 18, cannot enter into a contract. Someone that's mentally incompetent, maybe they have a legal disability and they're not able to take care of themselves completely. They can't make decisions on their own and their parents do that for them. They can't enter into a contract as an adult. Individuals that are under the influence or drugs or alcohol, okay? If someone's high, if they're drunk, they cannot make that legal decision because they are not of sound mind. They are under the influence, okay? And the last one is a semi-conscious or unconscious person. Now, unconscious person, of course, is not going to be able to make a decision for their health care. But a semi-conscious person, if they're kind of going in and out of it and they're going to agree to whatever, okay, whatever the doctor says they would agree to. So that's what we're talking about. We want to make sure that they are in their right mind, that they are awake, they're alert, they know what's going on before they actually make that decision to enter into that contract, have that surgery or whatever, okay? So one of our test questions, I think, is actually saying, Mr. Jones says that he didn't sign that surgical consent. What happens? Why does he say that? And it's probably because he signed it after he had like some medication, maybe a pain pill, a sleeping pill or something, and he just doesn't remember signing that. So we've got to be very careful giving patients medications and then asking them to sign things. You don't want to do that. So contract law or agency law. An agency is a personal relationship that's created by joining people together, an agent and a principal. So the agent would be the employee and the principal would be the employer. Now, with that being said, if you think about it, Mr. Scott Ballard is the principal of East Duplin High School. He's kind of like the boss at our school. And that's what this principal, the employer, is. They're the boss. So I want you to think about it like that. Don't get agent and principal confused, okay? So the agent, I would be the agent at Duplin County Schools because I'm someone that works for the principal, okay? So the principal is responsible for the actions of the agent, like Mr. Ballard is responsible for my actions. I am responsible as well, but him being the person in charge would be responsible, okay? Healthcare workers are abiding by contract law, okay? And we're here to protect the interest of our employers. Like if I work for the hospital and there's something going on, my job as a nurse and as the agent of that hospital, I need to protect the interest of my hospital, okay? Now, privileged communication. Privileged communication covers all information that is given to your health care provider by a patient. Any kind of past history, any kind of surgical history, any kind of complaints that you're having, anything that you talk to your doctor about is considered privileged communication, okay? So we as healthcare providers cannot share that information with anybody else unless the patient gives us consent to do that, okay? We've got to be very careful, even having paperwork laying around on a nurse's desk that another patient could walk by and see lab results on a patient, or talking on the phone, like if the nurse is talking on the phone with a patient and they're saying, they're talking pretty loud and another patient walks by and that other patient hears the information that you're telling that patient. So you got to be very careful about what you say and do when it involves patients' information, okay? Now, patients can share their information with somebody, like I actually have signed a paper that my husband can get information about my medical care because if something happens to me, I want him to be able to know what's going on and make decisions for me. But I have to have in writing who can get that information. I have to tell them, yes, I want certain information released, who can get it, and there has to be a time limit on on that, because what if I divorce and in 2 years my ex-husband wants information about me? Well, he can't get that if I've given it a time frame, okay? So you've got to give what can be released, who can get the information, and for what time frame. Now, there are exceptions, of course, to everything, but to privileged communication, there are exceptions where medical information is exempt by law. Now, the examples are births and deaths. We can't keep that private. If someone is born or dies, we have to let the health department know. Okay, we have to let for statistic reasons, we have to let that information be known. So if you have a birth at home, we can't just keep that quiet, okay? The medical providers have to know that. Injuries that are caused by violence. Remember, I just told you about if you're suspecting abuse, has to be reported. If somebody comes into the emergency room with a gunshot, immediately has to be reported. That can't be just quiet. Drug abuse. Communicable disease. And by communicable disease, I mean a disease that is a threat to your community. Right now, we're in this big COVID thing. So if someone in your home tests positive for COVID, we can't just keep that quiet. The agency that tested you for COVID will actually report it to the Duplin County Health Department. Same way they would if you had a sexually transmitted disease, if you had gonorrhea, chlamydia, syphilis, things like that, or even something like tuberculosis. Those diseases are a threat to our community, and it has to be reported, okay? Healthcare records. Your medical records are privileged communication. They contain information that has been about the care that's been given to you. So medical records actually belong to the provider that you see. They're not yours. They're the providers, the doctors that you see. But you do have a right to have a copy of those. Okay? So medical records are legal documents. And always remember, as a healthcare provider, when you're writing in a patient's chart or when you're documenting in any way, always remember that that document could end up in court, okay? It could be subpoenaed as evidence in a court case. So you always type grammatically correct. You always make sure that you don't have any typographical errors and there's no judgments or biases in those notes. If you make a mistake when you're writing in a patient's chart, errors have got to be corrected by drawing a straight line through it and writing mistake, putting error above it, and putting your initials. Now, don't go erasing stuff. Don't ever white something out, because that seems like you're trying to hide something. And if you just make a mistake in charting, you just make a mistake. We all do that. So don't try to hide anything. Let whoever knows or who will see that know that it was just an error on your part. You just wrote the wrong thing on the wrong chart or something, okay? So it says never chart a treatment or procedure until after you've done it. Don't ever chart that you've given a medication until actually you have physically given that medication, okay? Don't ever chart unless you've actually done it. Okay, and in the same aspect, if you do it, make sure you chart it, okay? And all medical records have to be destroyed in a certain way. You can't just throw medical records in the trash can, okay? They've got to be shredded, and they've got to be where no one can ever put them back together. Computerized records have created a lot of problems with us where it comes to maintaining confidentiality, because when you log on to the computer, you can go in and look at whatever you want to look at. So we do require limited access to records. If you're not directly involved in that patient's care, you do not have a right to pull that patient's chart and look at it, okay? When you're logging on to the medical record system, you have to have a password, of course, and we constantly monitor and evaluate computer use. When you're not at your computer screen, you have to log out, simply because someone walking behind you could walk by and see something in a patient's chart, and you cannot do that. That would be a HIPAA violation. Speaking of HIPAA, HIPAA is actually the Health Information Portability and Accountability Act. All this is saying that that patient's health records are private. Anything and everything in that patient's health records is private, okay? Now, I can say, I had a patient yesterday that her blood pressure was 198/100. She started having a seizure. Now, I can tell you that something happened like that because I'm not giving you any kind of identifying information. You have no earthly idea who that patient is, okay? But if I start telling you, well, she's a freshman at East Duplin and she has red hair and she's in my Foundations of Health Science class, 3rd period. So if I start giving enough detailed information that you could figure out who it is, then it's a violation. But if you don't know who that person is, and I'm just giving you an example of something that's happened, that is not a violation of HIPAA, okay? And you can be fined huge amounts of money if you violate HIPAA and you talk about patients' medical information, and you should not be doing so. So ethics. Ethics is just right or wrong. Dilemmas, you know that stealing is wrong. You're not going to do that. You know that cheating on a test is wrong, and you're not going to do that, okay? So ethics is simply principles of right and wrong, whether some people consider things right and wrong and other people do not. So it's just how you feel about things being right or wrong. So dilemmas in healthcare. Euthanasia. What is euthanasia? It is like mercy killing, like animals at the dog pound are euthanized. They're put to sleep, okay? Do you believe in that? Aborted fetuses being used for research. Can a patient be refused expensive treatment if they can't afford it? Do you believe in medical marijuana, human cloning? Of course, human cloning is illegal. So it's just whether you feel like something is ethically right or wrong, okay? So an ethical code, saving a life and promoting health above all else. That's what all healthcare providers are expected to do, okay? Save life and promote health. Treat all patients equally. Doesn't matter if you are the principal, the president, whatever, or you're a homeless person on the street. You deserve the same quality care, okay? Keep your patients comfortable and preserve life when possible. Provide care for all individuals to the best of your ability. Okay, that's what, as healthcare workers, we're supposed to do. Now, confidentiality is just all patient information remains private and is only shared with the healthcare team if needed. If I don't need that patient information, there's no reason to share it with me, okay? So it's only going to be shared with members of that team that need to know that information about that patient. Now, a patient's Bill of Rights, just like the Bill of Rights, it just lets us know what patients can expect. Now, a patient is anyone that's considered being cared for in a facility, okay? So several things is considerate and respectful care, complete information, privacy, refusing treatment if they want to, okay? I want you to read through all of the patient's Bill of Rights, okay? Now, this one is very important, and it is reasonable response to a request for service. Let me give you an example of that, and that's actually a test question. So your patient hits the call bell. She's had surgery, and she says, I'm hurting. Can I get something for pain? And, you've got to look in the chart. So it might take 15 minutes to get her something for pain. But if she calls back in an hour or hour and a half and she's not gotten pain medicine yet, you have violated her Bill of Rights because you've not given a reasonable response to a request for service. She asked for pain medicine. It was ordered, and you didn't give it in a timely manner. So that is a violation of that patient's Bill of Rights, okay? OBRA is the Omnibus Budget Reconciliation Act, and it just says that we've already talked about this, that federal law regulates education and testing of nursing assistants, okay? Everybody's got to be tested and make sure they can do their job. This is the Residents' Bill of Rights, and I'm going to let you read through that. I'm not going to go through that. And it just A resident is someone in like a nursing home or